Hello, we're all here. Hi, I'm Elizabeth Knudsen, and today I'm giving an informative speech. And first I'm going to start out by asking who has ever been to either a hospital or a doctor's office? Everybody. Of course, so either you've been in an emergency situation or you've just gone to have your checkup. Well, there is one thing in common in all these situations is you're going to come in contact with either a doctor or a nurse that has good bedside manner or poor bedside manner. And you can definitely tell the difference between them. I'm going to speak about nurses because I am a nursing student and I am about to graduate. But nurses who portray a good bedside manner are better able to take care of their patient and initiate change to promote their health. It's one of the first things that we have learned in school, and it's in every single one of our books. We have to make sure that we know how to communicate with our patients to be effective. I'm going to explain to you how the nurses can use the behaviors and communication techniques. First, it's going to happen right the first time that you meet the patient. And we're going to start before we even walk into the door. And then we're going to continue building a therapeutic relationship with them. There is a nursing code of ethics that the American Nursing Association has put out. It speaks of the many responsibilities of nurses, and specifically in provision 6.1, which can be found on pretty much any website, but this specifically came from nursingworld.org. It says that nurses must always strive to do the right thing. It is his or her moral and ethical obligation to the patient. Also says that nurses must create, maintain, and contribute to growth of character habits like respect, compassion, patience, and competence. Good bedside manner can change a patient's outlook on their own diagnosis. It can make them feel important. They'll open up and talk to you maybe about their problems or their symptoms, or even ask questions if they feel comfortable with you. So how can the nurse actually implement this? Well, like I said, it starts before you even meet the patient. The initial introduction sets the tone for the rest of the relationship. During the first semester, our textbook, which I brought today, which is called The Fundamentals of Nursing by Berman and Snyder, it taught us that we must incorporate scientific competence and aesthetic knowledge, which is compassion, sensitivity, and understanding, which comes from the appreciation of each individual and the ability to care for them. Nurses need to strive to understand the patient in his or her uniqueness. So for a first impression, research. Get in a chart, look at their name, make sure you know how to pronounce it correctly, look at their diagnosis, maybe look at their support system, maybe their age, their culture. Ask other nurses, ask other doctors who have already seen the patient, get some information from them. Make sure you're confident about the health problem that they're dealing with, and if you don't know, find out. So when you go to the room, knock. This is their home, away from home. This is their personal space. Show respect by knocking and asking to come in. Introduce yourself, give a handshake, and again, pronounce their name correctly. Body language and physical touch are very effective techniques that a nurse uses. It shows more true feelings than what's actually being said. For example, I can walk into a patient's room and I can say, I'd be happy to sit with you and chit-chat for a little bit. But yet I'm constantly looking at my watch and fiddling. It obviously shows something different. So they're more likely to believe the nonverbal behavior. Body language. Have good posture. You don't want to be slouchy and tense. Sit down. Be on their level if they're laying in the bed. You don't want to show any intimidation. Facial expressions. You can convey every kind of feeling through your facial expressions, positive and negative. So the patients are very quick to pick up on a facial expression that shows that you're unsure or maybe you're uncomfortable. Eye contact. You want to come across as confident, not weak. Personal appearance. It shows how you feel. Make sure that you're well kept and that you have on your lab coat or that you're showing the part of being a nurse. Your tone and your rate of speech. You don't want to walk in there and talk to your patient very fast and quick because it's going to show that you're in a hurry or maybe that you don't care. Speak slowly and softly. It can calm a very anxious patient, and maybe that's what they need. And always speak in layman's terms because doctors usually throw out the medical jargon, and it's up to the nurses to be the mediator, to help them understand what's really going on. And use of touch. This can reinforce your caring feeling towards the patient. And the very last thing that you want to do on your introduction is have a little bit of a social interaction with them. Small talk. Ask them about their kids. Maybe talk about the weather. Something that gets more on a personal level with them. So now that we've had this introduction period, hopefully your patient is comfortable enough with you and maybe trusts you. So we're going to continue to build an effective therapeutic relationship. And how we do that, how we build that therapeutic relationship, it may happen in days, it may take days, or it possibly could happen in a couple of minutes. From an interview that I conducted on March 5th, Brenda Holly, who is a 30-year plus registered nurse and certified nurse midwife, she says that the biggest deterrent from effective bedside manner is preoccupation. Nurses need to give undivided attention to all patients and actively listen to their concerns in order to build a good relationship. So your physical presence, don't be rushed. When you ask a question, just ask one. Don't ask 3 or 4 all in a row because the patient's probably just going to answer the first one. Choose the right time to speak to them. Silence is also therapeutic. And most importantly, get your nose out of the computer. I just recently had an experience, and I would say about 80% of the time there was no eye contact, the nurse wasn't looking at me or paying attention to me, they were typing on their computer. Active listening. Now this is the most important nursing technique. It means listening actively, using all your senses, not just your ears. It conveys the attitude of caring and interest, encouraging the patient to talk. So don't interrupt them. You can say things like, I see what you mean. You can ask questions to clarify or to get extra information. And make sure that the patient closes the conversation. You don't want to be the one to close it because it may show the patient that they're unimportant. And don't sound insincere or phony. You want to assess and anticipate the patient's needs. Don't wait for them to ask for something. Take it into your own hands. Make sure that you're always asking them about their pain. Maybe if they want to change positions. If they have to go to the potty. Maybe some personal needs. Do they need anything? Can they reach everything? And something that I see on a daily basis that isn't done enough is patient teaching. Maybe you want to teach about their meds, maybe their new meds. Could be even their old meds that they've been on. You can explain to them how to take them and why they take them. Diet and exercise. This can be really tricky because a lot of people don't want to hear about weight issues. But it is your job as a nurse. An effective patient-nurse relationship can go a long way in overcoming a diagnosis or an illness. So patients treated like a person. Don't treat them like a customer. I'm sure that we would all prefer a nurse with competence and bedside manner. So I've discussed how a nurse's goals, or a nurse can gain a patient's trust and respect, and it starts before you actually meet them, and it continues during the care. We don't have to know them for days. These skills are not only invaluable, but they are the foundation of the nursing profession. They can help you communicate with a nurse more efficiently, and allow you to speak up if she isn't holding herself to these same standards. I can't promise you a wonderful experience, but you know that they were taught how and ethically called to show such an attitude. 10 minutes?